areas or the pillars, guide and review.
For the most part of the day, 56 partners and the Ministry of Health presented accountability for all resources in form of money, human resource and supplies, among others, that were used during the 112 days the country suffered the Ebola pandemic.
For UNFPA, as the Sexual and Reproductive Health Agency, we managed to mobilize over 400 resources from our own core resources, but also from the Humanitarian Trust Fund, to ensure the continuity of sexual and reproductive health services. We know that when emergencies happen, and if it's Ebola, pregnant women don't want to go to the hospital.
We have channeled all of our £3 million of direct funding onto this Ebola response through UN partners.
Foreign mission heads, non-government organizations, the United Nations, European Union, and the World Health Organization pledged to continue working with Uganda, especially in the area of research on therapeutics and vaccines.
Medical Research Council have just announced a grant for new research coming into Uganda on some of the mental health impacts of what's happened in Mabende and Cassandra as well.
It was established that more than $20 million, or approximately 74 billion shillings, from the various partners remain unspent. The money is also still available for use until at least September. The Ministry of Health says they still have pending needs for the money.
To discuss and come up with a good plan on how to utilize the unspent balances, not the proposals that we have seen here. Those proposals are not going to contribute or support building resilient systems. They are going to contribute to wastage of money.
Achieving this is a result. If we were not able to control this outbreak, we would have had to spend at least $1 million to $3 million a day. We have seen that happen in the various outbreaks. So that is the real achievement we should be talking about.
Uganda was able to contain the Ebola outbreak that had spread to 7 districts within 69 days. Walter Mwesije, NTV.